3 months after a completely routine annual checkup. 71-year-old Thomas had lost something he never ever expected to lose: his independence. Before that morning, he was retired, sharp as a tack, still mowing his own lush green lawn every Saturday, and driving himself down to the local lodge for Tuesday night poker with the guys. He felt perfectly fine. But his wife gently dragged him in for a physical he'd been putting off for 2 years. The room smelled faintly of rubbing alcohol, and the fluorescent lights hummed overhead. The doctor looked over his charts, smiled reassuringly, and said, "Everything seems fine." Then he added those 6 words that so often alter the course of a senior's life: "Let's just run a few tests." At that exact moment, Thomas didn't know it, but his Saturday mornings on the lawn and his Tuesday poker nights were already in jeopardy. 90 days later, Thomas was staring at the rain sliding down a dark hospital window while an IV monitor beeped monotonously beside him. He was dealing with severe, exhausting complications that had absolutely nothing to do with why he originally walked into that clinic. The vibrant, independent life he had enjoyed just 3 months prior was completely on hold. Have you noticed a similar pattern creeping into your own circle of friends, or perhaps your own medical routine, where you go in feeling perfectly healthy and walk out with a list of aggressive intervention options you didn't even know existed? When was the last time you walked out of a doctor's office feeling genuinely reassured, rather than carrying a heavy fog of new anxieties and scheduled procedures? The reason many of us never hear about the hidden side of these routine tests isn't because doctors are ill-intentioned. They aren't. They care deeply, and they work incredibly hard. But the modern medical system is moving too fast. In a rushed 15-minute appointment, everything looks clean on paper. Yet a quiet cascade is often set in motion simply because it's standard protocol. Over the years, I've worked closely with hundreds of older adults trying to preserve their autonomy, and I have seen this exact chain reaction happen to healthy seniors who felt bulletproof. And if you've ever sat on that crinkly exam table paper, listening to it rip every time you move, staring at the ceiling and wondering if a proposed test is truly necessary for your specific stage of life, let me know with a quick like. It helps us reach more folks who are quietly dealing with this exact pressure. What happened next to Thomas is exactly how the protocol takes over. That first routine test, a standard PSA prostate screening that his doctor ordered just to be safe, came back slightly elevated. Thomas wasn't having any issues. His energy was high. But once a lab report flags a number in red ink, the medical system is trained to follow a specific path. Suddenly, Thomas was being referred to specialists and undergoing uncomfortable, painful biopsies. They told him it was a low-grade, slow-growing tumor, the kind of microscopic change that moves so slowly that most men over 70 outlive it without ever knowing it was there. Fortunately, there was a simpler, incredibly hopeful option available right from the start. It's called active surveillance, or watchful waiting. It means monitoring the numbers with simple blood tests without jumping into aggressive treatments. The good news is, many men who choose this path maintain their exact quality of life for decades, fully protected and completely symptom-free. But Thomas didn't know that was an option. He trusted the standard protocol and went through with heavy radiation treatments. Within 8 months, the treatment left him dealing with a sudden, humiliating lack of bladder control that changed how he lived his days. The Tuesday night poker chips sat in a dark drawer, gathering dust. He stopped going because he couldn't bear the thought of leaving the card table every 20 minutes while his friends watched. If you've ever agreed to a medical test and later wished you had asked more questions before the follow-ups began, tell me about your experience in the comments below. Your story might be the exact warning or comfort someone else needs to read today. While Thomas was navigating his recovery, another healthy senior named Gloria was facing her own quiet turning point. One afternoon, Gloria, a 72-year-old former elementary teacher, looked out her kitchen window and realized her beloved rose bushes were completely choked with weeds she hadn't touched in weeks. Her gardening gloves sat abandoned on the counter. For years, tending those roses in the crisp morning air was her sanctuary. But during her last annual checkup, she had been sent for a routine bone density scan. She hadn't fallen, she had no pain, but the machine flagged her bones as below normal for her age. Her physician immediately put her on a long-term prescription for strong bone medications. What's rarely explained in a busy clinic is that taking these specific medications for years can sometimes cause a rare, severe stress fracture in the thigh bone, the very structure the medication is meant to protect. By the third year, a deep, aching pain developed in Gloria's leg, so sharp it felt like a hot wire. She stopped her daily walks because she assumed her joints were simply giving out due to old age. But the story doesn't end there. Gloria decided to get a second opinion. Her new physician looked at her whole profile, stopped the medication, and put her into a structured balance and strength program. Within 4 months, the aching stopped, the bone healed, and Gloria was back outside with her gardening shears, enjoying the sun on her face. The single most effective way to protect your bones after 65 often isn't a pill, it's dedicated balance support, like gentle Tai Chi, which naturally strengthens your baseline and cuts fall risks in half with 0 side effects. This brings us to a completely different type of routine screening that catches many seniors by surprise: the routine cardiac stress test. Let me tell you about Arthur, a 69-year-old retired civil engineer who loved hiking. Every autumn, he would hike the mountain trails with his 10-year-old grandson, Leo, tracking animal footprints in the dirt. Because Arthur was approaching 70, his doctor suggested a routine stress test on the treadmill just to get a baseline. Arthur felt great, but he agreed. Here is the piece that is rarely discussed: routine cardiac stress tests in seniors who have absolutely no chest pain or shortness of breath have false positive rates that can reach up to 40%. The machine flagged a minor abnormality on Arthur's test, which immediately sent him to a local hospital for a cardiac catheterization, an invasive procedure where a thin tube is threaded directly into the heart vessels. During the procedure, they found a partial blockage. Partial blockages are incredibly common as we age. Millions of independent seniors live active lives with them without ever experiencing a heart event. Yet the standard protocol pushed for a surgical stent to open the vessel. What Arthur wasn't told was that massive clinical trials, including the landmark ischemia trial, have proven that inserting stents into stable, symptom-free patients does not reduce heart attacks or extend life any better than optimized medication and simple lifestyle adjustments. Arthur received the stent, but he was placed on heavy blood thinners that made him bruise at the slightest touch. He became so terrified of tripping and bleeding on the rocky trails that he stopped hiking entirely. That October, Arthur sat on the porch while his grandson went up the mountain with someone else, leaving Arthur feeling like a ghost in his own life. The good news is, you can avoid this specific cycle entirely. If you have no chest pain or unusual shortness of breath, the conversation with your doctor shouldn't be about invasive testing. It should be about optimizing your actual daily inputs: blood pressure, sleep, and consistent movement. That is where the real cardiac protection lives after 65, and none of it requires a hospital gown. The exact same protocol-driven trap is currently waiting for seniors in 2 other very common checkups. The first is the routine carotid ultrasound, a scan of the neck arteries meant to prevent strokes. For a senior with no neurological symptoms, finding a silent, stable narrowing often leads to an aggressive clearing surgery that actually carries a 2% to 3% risk of causing a stroke during the operation. The second is the routine colonoscopy after age 75. For an older adult with a clean history and no symptoms, the intense physical toll of the liquid bowel prep can cause dangerous dehydration that stresses the kidneys and heart. Combine that with a 1 in 500 risk of a physical tear in the colon wall during the procedure, and the safety math changes completely. The slow-growing polyps they are looking for take 10 to 15 years to ever become a threat. But remember Thomas? His story didn't end in that hospital chair. Frustrated by his missing poker nights, Thomas finally decided to change his approach. At his next follow-up, he didn't just nod and accept the next round of referrals. Instead, he pulled a small, slightly crumpled note card out of his pocket. He sat forward, looked his doctor in the eye, and asked what would happen if they just stopped the aggressive interventions, watched the numbers, and focused on physical therapy instead. His doctor didn't get angry or defensive. In fact, he sighed with relief, sat back in his chair, and said, "I'm glad you asked, Thomas. We can absolutely do that." It took 5 months of steady daily walking and targeted pelvic floor exercises, but Thomas slowly, steadily regained his baseline. Last Saturday morning, the morning air was crisp, and the teenager was no longer mowing his lawn. Thomas was behind the mower himself, breathing in the smell of fresh-cut grass. And on Tuesday night, Thomas walked into the local lodge, pulled his glossy poker chips out of the drawer, and sat down with the guys. He was back in control, not because he avoided medical care, but because he became an active partner in it. Every time a doctor recommends a screening test, especially if you feel perfectly well, I want you to have these 5 specific, uncombative questions ready on a note card. 1. What is the false positive rate for this test in people my age? 2. If this test finds a mild abnormality, what are our soft, non-surgical options? 3. What is the realistic procedural risk if we follow this pipeline to treatment? 4. What happens if we choose to monitor this with watchful waiting instead of intervening? 5. Is there a non-invasive lifestyle approach that achieves the same safety baseline? Any physician who is truly a partner in your longevity will stop, sit down, and welcome those questions. Next week, I am breaking down something that ties directly into this journey: the specific daily medications routinely prescribed to older adults that have a completely different, much more aggressive risk profile at 70 than they do at 50, and exactly what you must ask your pharmacist before you accept a refill. If you are currently taking more than 2 daily pills, make sure to smoothly subscribe so you don't miss that guide when it drops. The choices you make on that crinkly exam table paper don't just dictate your medical file, they dictate whether you get to keep your weekends, your hobbies, and your daily peace of mind. The body that carries you through your 70s and 80s is being shaped entirely by what you choose to say yes or no to during those brief appointments. And for many people, that realization changes everything. Because the real question isn't how old you are, it's whether your daily life still feels like it belongs to you.